Welcome everyone. This is Marcy Gallagher with Mountain Pacific Quality Health. And today we are presenting kind of an open office hours call on Nhsn. We have our data analyst, Tom Vincent, who will be doing a short presentation. And, this was really intended to get some comments and feedback or any questions that you might have about Nhsn, the new point of care testing module, or upgrading to the SAMS 3 to report into that module. So just a few housekeeping items that this meeting is being recorded. Please mute yourself as the lines are open. If you would like to ask a question, you can certainly unmute yourself, or we do have the chat feature down below, so feel free to put your comments or questions in chat. And I think at this point, I will go ahead and turn it over to Tom. So thank you.
Thanks, Marcy. Hello, everyone, and thanks for taking a few minutes out of your very busy schedules to join us today. As Marcy said, my name is Tom Vincent, and I work with the analytics department here at Mountain Pacific Quality Health. The plan today was just give talk for a few minutes regarding the SAMS security update and a little bit about the POC module that is now available in Nhsn for hopefully most of you, I hope. And then I want to allow some time at the end for discussion. As we've heard so many times this year, we're all in this together, and if we can learn from each other in this today, that would reach one of our goals. So to start with, I'm hoping that all of you have at least started the process for your SAMS Level 3 security update. If you have not started the process, please do so as soon as possible. Today would be good. CMS is going to want the data, begin entering data as soon as possible. And the SAMS process does take some time to complete, several weeks, in fact. They are right now, as you can imagine, very busy with quite literally just about every nursing home in the country is going through this process for security clearance. So it does take some time to complete. So again, if you have not started, please get started as soon as possible. On that, I would also recommend, if you have not already done so within your nursing home or your facility, please make sure that you have more than one person that can obtain the security clearance for Nhsn. It's always good to have a couple backups to whoever your Nhsn administrator is. Will want 2 or 3 backups depending on the size of your facility. So please make sure that you have multiple people and multiple users completing the process. So that being said, I just want to go over a couple resources for the POC module, and then I will also take a few minutes and actually log into the module so that those of you who have not seen it yet, you can kind of get an idea of what it looks like and how the data will be entered. So I'm going to go ahead and share my screen here. So this is a website that may look familiar to most of you, if not all of you. It explains the COVID-19 module, which, if you look over here in the flow chart, you can see where the new testing module is included in that same COVID-19 module. So it'll be very easy to find when you do obtain access to it. Scrolling down, of course, there's all kinds of information in here. There's a couple of links right in here. One talks about increasing your SAM's security level. So again, if you have not started the process, this would be a good link to follow. And if you are having difficulties with that process, please contact nhsn at cdc.gov. And you'll want to put in the subject line, something along the lines of security upgrade or something, something to that effect. And it will hopefully expedite your request and get you some assistance sooner than later. A little farther down, again, we have another link to the SAM's level access, which, and then down a little farther in the training, as you know, they offered training for the new module for a couple days last week, and they have put the slides out here for you to view. Those of you that were not able to attend the training, the slides are here. We'll just open them up here. They're very intuitive. I went through them, and even without the subject expert speaking, I was able to follow along pretty good. And they're very complete. They talk a lot about the point of care testing, some of the reasons why, and they go into the process of obtaining your SAM's clearance and step-by-step on how to do that and where to find that information. And even for as we alluded to earlier, when you have backup users for NHSN, if you are the database administrator, it will show you how to add those users and give them the permissions and things they need in order to assist with the data entry if needed. So very informative here. If you did attend, good review. If you didn't, still would be very useful. A little farther down, you may remember when the COVID module was first starting, we had office hours, and we suggested possibly using paper forms to gather the information until your access was granted to the COVID module. Well, they have that here as well. And we'll open the form here. This is the data entry form. It's a very, I guess what I see as a straightforward form, one page. You can start gathering your data for some of your residents and or staff. And then when you gain access, you will have that information to begin entering the data into NHSN. In addition to that is a table of instructions, which this document goes field by field on how to enter the data into the tool. I'm not a clinical person at all, and I found this, at least on the surface, to be again pretty straightforward. There is not pages and pages of information that you will need to get entered in there. That being said, I'm going to, let's see if I can get into here. I'm going to go back and I'm going to go ahead and log in to NHSN so that we can see kind of firsthand for all of us. First of all, you will kind of see how your login process will take place when you receive your grid card. And then also we'll get a look at the point of contact reporting tool. This page should look familiar to everybody, and I think most all of you are using entering your data in the form on the left. When you gain your grid card, which looks just like this picture, you'll start to log into NHSN using this side. And again, we'll go to the grid card column, and I will put in my username. And hopefully I punched all the right buttons. And next you will enter the 3 values from your your grid card, which again, it's just a matter of taking the value that is in C1, which in this case it would be an X, and E2 and so forth. Very simple. E2. And I'll click login. And then we get into the landing page and Nhsn reporting. This may or may not look a little bit different than what you will see, depending on your how you're set up. I will choose the long-term care facility component. And then I have a test facility that we're going to go into for the purposes of today. You obviously in this drop down will just see your facility. And we'll submit. Oh, we got a message here. Oh, okay, it looks like Nhsn is going to shut down for a little bit this weekend for maintenance. So good to know. Here again is our page. Over here you see the tabs for different areas. COVID-19, you're all familiar with. You will notice when you hover over that tab that now you have the POC test result reporting option in that drop down. Simply click on that, and this is basically it. It is a one-page data entry form. The good folks at Nhsn have set up some pretend people for me. The Doe family is in here, as you can see. I'm going to go ahead and click on John Doe here and select. And his information, because it's already been entered into the system, obviously will pop up here. Only the little red stars are required. And then down here at the bottom, we're going to go ahead and add a test result. So I'll click here. And you will use the calendar to select the date of the test, the device, which I think there's only 3 that you will be able to choose from. Based on that, which test would be ordered, and then the specimen source. I think there's only just the nasal swab and the nasal and throat swab, if I'm not mistaken. Obviously, you'll probably have to re-enter Mr. Doe, his records to put the test result in when that becomes available. And then the specimen number, the doctor, we just have Dr. John here right now. And was the patient symptomatic and or pregnant? Once your data is entered, we'll save and you're done. And then you can go to the bottom here if you're entering multiple, and we're going to start a POC test result report, which will clear. It'll give you a little warning that it's going to clear everything out. So make sure you save if you wanted to. And we start all over. And that is, as they say in a nutshell, that is the reporting tool for POC. Again, once you receive your clearance, you'll have access to this, but I recommend that, using the paper form or would probably be the most useful, but you can start collecting data at any time using that paper form. I'm going to put up another, if I can find the right button here. There we go. And I just made a couple little resources for you all that you may or may not. This first one is a link to that website that we started our conversation with. The second is probably the most asked question. If you're having difficulties with your SAMS clearance, please contact NHSN at cdc.gov. And in the subject line, here's what the enhancing data security, put that in the subject line and hopefully it will expedite your question. You can also try to contact SAMS directly. They offer an actual phone number. I don't guarantee that at this time an actual person will answer. They are very busy, but the line is available, let's see, what is it, 8 to 6, Monday through Friday, Eastern Standard Time. And then of course they also have an email address. If you have some general questions regarding maybe logging into NHSN, things of those natures, feel free to zip me an email or one of our nursing home task leads in your state, Lisa, Marcy, Jill, Maggie, and we'd be happy to try to help you. Hopefully we can find an answer for you if to your questions. And that being said, I'd like to leave the rest of the time for discussion. Hopefully we've got some folks on here that are in the process and are able to enter their data. And I'm sure we have some folks that are not quite there yet that still have questions. And my hope is that we can help each other out and answer some questions. So time over to everybody else.
Hey, Tom, this is Marcy. Can you hear me?
I can.
Okay, so we had a question in chat. If not participating in the point of care testing due to having an associate lab in town to run the molecular PCR test where they get the results back in 72 hours, do they still need to do test reporting into NHSN?
My understanding is yes, that CMS, this is the way that they're gathering data for this. They want the nursing homes putting the data into NHSN, and then it is distributed to the state health HHS services and other entities through the NHSN. But I would be happy to verify that for you just to make sure. But that is my understanding, is that they're asking all nursing homes to do this. But I will seek verification and I will forward on my answer. Is it okay if I forward it to you, Marcy, and then we can forward that out?
Yeah, we'll get it out to everyone.
Okay, I will verify that then.
Okay, we have another question in chat, Tom. I may have missed this, but how long does it take to get the enhanced security?
Oh, good question. It takes weeks. I've heard stories of 4 to 6 weeks in some cases. It is a timely process. I know when I applied for my SAMS card, that was about 8 years ago. It took almost a month at that time, and they weren't as inundated as they are now. So that's why it's imperative that you start this process ASAP.
And just also make sure you save all your documentation.
Absolutely. Absolutely. Save your documents, much like you did with the COVID module. In case, there is a delay, at least you've got something in writing that shows that you've made, that you are in the process, you've attempted, you're collecting data on the paper forms. All of that stuff, I think, would be useful.
So anybody having any issues or anything coming up with the NHSM module that you'd like to share? Something that's always good to learn from each other. Anybody entering in the system that it's going pretty smoothly, or any other comments that folks might want to pass along?
Yeah, we've got, I know, we have a very limited number of our nursing homes that have conferred rights to us. And I have seen some data entry in the system from a couple of those homes. So I know that there are some people that are already entering, but again, we had, some of the nursing homes work with us in the previous scope of work who were kind of ahead of the game because of that. So, but it is limited so far in what I'm seeing. But if there's anybody out there listening right now that has had some success, would like to offer up any advice.
Tom, can you speak of any deadlines?
Oh, that's a really good question. So unofficially, and I can't stress that enough, unofficially, I've heard from two sources that are saying that CMS is offering a grace period, which will be January 2021. Now, I don't know if that's January 1st, January 15th, or whatever, but they are offering that grace period, but after that, they will start kind of, I guess, for lack of a better phrase, cracking the whip for people to get their data in. And again, those are unofficial, but I have heard January 2021 from two different sources. But yeah, I've seen nothing official. And my thought is, and again, this is just my thought, is that, they do know that the SAMS process does take quite a bit of time, and they want as many people on board as possible before they start enforcing anything. And COVID year or not, we've got the holidays coming up. There will be people wanting to have their days with their families, etc. So my hope is that they'll get into the holiday spirit and grant a gracious grace period for everybody before they have to start entering their data.
Thanks, Tom. And then we have just a couple other questions. Do folks start reporting immediately? I believe that once they have access, they can go ahead and start entering.
Yeah, if you have access, please, yes, absolutely, start reporting. Sooner is better.
Okay, and then the next question, do they have to enter each resident and each employee individually?
Well, if they're testing them. If they're testing them, you have to put the person in as an individual, yes.
Okay.
And the, and again, some of these folks, you'll have to revisit their record when you get a result of the test. So that's why it's, the drop down and you're gathering residents and or staff in your individual databases, if you will. But yes, each new person, as they are getting tested, does have to be entered in. It is, and I understand that's just something else to do for all of you, like you didn't have anything else to do.
And then just an add-on to that. So what do you use for the resident ID? Is that something that is up to the facility?
Yes. Yes, that's the facility, as I understand it, And the data that I've worked with even shows that each resident has an ID. So it should be somewhere on their records for the facility. But we can, we can check that instructions too. That might have resident ID conditionally required. If the testee is a facility resident, enter the alphanumeric resident ID. This is the resident identifier assigned by the facility and may consist of any combination of numbers and or letters. So should be an ID that remains the same for all admissions and stays. And the same with the staff ID. It says here, alphanumeric staff ID number. It's a number assigned by the facility and may consist of any combination of numbers and or letters. So.
Great, thanks, Tom. Okay, just one other question, Tom. If we don't have, and maybe I think this was the one that came before, this question might have come before. If we don't have a point of care testing capabilities within the long-term care, do we still need to do this?
If you don't have the point of care, say that again, Marcy.
If we don't have the point of care testing capabilities within the nursing home, do we still need to report? And I was thinking that was similar to the question that came where they send that out to.
Yeah, my understanding is you still have to report, and I know on the form there is a place for the CLIA number or waiver, and I think that has to do with whether or not you can conduct the test within your facility. But I think if you have a staff member or a resident that is getting tested, I think you still have to enter it in for your nursing home. And again, I will verify that with, because it kind of goes, it's basically the same question as before. Do you still have to do this? And I will verify that if there are exceptions.
Yeah, that would be helpful because we.
Yeah, I will do that right after we finish this call.
Okay, well, it is 2 o'clock, I guess, Mountain Time. Our half hour went by pretty quickly. So if you do have questions that you think of, Tom's email is on the screen, tvincent@mpqhf.org, or again, you can contact any of us at Mountain Pacific, and Tom will do some clarifying and send that out. And we will also be sending out the recording too, to everybody who's participated. So there's nothing else. Thank you so much, everyone. And thank you, Tom.
Yeah, thank you all for joining us, and keep up the good work, of course. And I hope everybody has a good holiday season. So.
Thank you very much.